Hi guys, so I did my project on thrombin, and thrombin is classified as a coagulant, or as a medication it would be considered a hemostatic agent that is often used in surgery to control large amounts of bleeding. So thrombin is actually a natural enzyme that is found within our body, and it's derived from prothrombin. So prothrombin is produced in our liver. So to talk a little bit about how thrombin works. So thrombin assists in the conversion of fibrinogen into fibrin. And as a medication, thrombin just speeds up this conversion process in our body's natural clotting mechanism. So clot formation actually happens in 3 different stages. So to put the physiology of clot formation in the easiest way, so stage 1, thromboplastin is formed. And in stage 2, thromboplastin converts prothrombin into thrombin. And the last stage, stage 3, thrombin then converts fibrinogen into fibrin to form the clot. So to get a little more in depth regarding the mechanism of action of thrombin, so thrombin starts by removing peptides from fibrinogen to form a fibrin monomer. And so this fibrin monomer then polymerizes or combines with a network of other fibrin monomers to essentially create a large thread of fibrin. So this thread then serves as the framework of the blood clot. So you can kind of think of it as a net that traps blood cells to form the clot. So it sounds a little technical and complicated, but this process is actually very fast and occurs within seconds. So some of the major side effects of thrombin. Anaphylaxis and hypersensitivity. They're more of a risk with the thrombin products that contain animal proteins such as Recothromb, for example. Recothromb contains hamster or snake protein. So a second side effect would be antibody formation. So this is due to prolonged exposure of thrombin in some patients. And it's been reported with bovine thrombin, and it can be life-threatening as these antibodies will cross-react with our own human natural coagulation factors. And last, thrombosis has been reported in patients with cases of topical thrombin entering the circulatory system, which can result in death. Some of the major contraindications of thrombin. So thrombin is contraindicated for use on large blood vessels as it runs the risk of intervascular clotting and again can result in death. So thrombin is actually not used to treat, therefore it is contraindicated in use of patients that need treatment of severe arterial bleeding. So thrombin is contraindicated in patients with afibrogenemia as fibrinogen will not be present within the patient's blood. And Recothromb is contraindicated in patients with a hypersensitivity to hamster or snake proteins. And this makes me kind of wonder how anybody would even know they have sensitivity to those proteins. So thrombin with bovine origin, some of the products with bovine origin, such as like Thrombostat or Thrombin JMI or Thrombin R, they're all contraindicated in patients with a known hypersensitivity to bovine. So thrombin with bovine origin is contraindicated in patients that have developed antibodies against the bovine thrombin. So adult routes and dosages. Dosages are going to vary depending on the type of thrombin product used, and also it's going to depend on the amount of bleeding that may be encountered. So thrombin is applied topically, and it's also measured in units. So subtypes of forms of thrombin come as reconstituted solutions, powders. It can be combined with gelatin sponges. It can also be combined with flowable gelatin. So thrombin comes in strengths from 800 to 20,000 units. Again, just depends on the product used. So some of the typical dosages of some of these different thrombin products, such as bovine. So typical dose could be 100 units per milliliter on bleeding surfaces such as the skin or mucosal surfaces, or in situations where heavier bleeding is to be expected, such as like abraded surfaces of the liver or spleen, that's going to be 1,000 units per milliliter. So recombinant thrombin, such as like Recothromb, typical dose would be 1,000 units per milliliter, and that's just, again, depending on the size of bleed. So Recothrom is available in 5,000 and 20,000 unit vials of powder, but it must be reconstituted with 0.9% sodium chloride before use. Human thrombin, so that's Evithrom, it's available in vials of 2, 5, or 20 milliliters and contains 800 to 1,200 units per milliliter. And it also can be used in combination with gelatin sponges. So the pharmacokinetics of thrombin was a little difficult to find. It's going to be a little bit difficult to explain because thrombin essentially is not systemically absorbed, because obviously that would be dangerous. So the absorption, thrombin is applied topically and it's absorbed at the site of bleeding to provide a direct clotting effect. And this works by converting the fibrogen into the fibrin clot. So distribution, again, thrombin is not distributed through systemic circulation, so it stays at the site of bleeding. Clotting time is going to vary. So, for example, it's dependent on the concentration of thrombin. So if we have a higher concentration of thrombin, we're going to have a faster clotting rate. Metabolism, we don't really metabolize thrombin. So prothrombin, it's transformed into thrombin by the clotting factor thromboplastin, and then thrombin transforms fibrinogen into fibrin, which combines with our platelets in our blood to form the clot, and then thrombin as a medication just speeds this process up. Excretion. So essentially, thrombin is not excreted through any of our major body systems because, again, it's not systemically absorbed. So it can stay at the site of bleeding. It does not need to be removed. So degeneration and reabsorption of the fibrin clot is just going to be achieved by our natural healing process and our body's natural clot breakdown. So because I couldn't really give you a lot of information regarding the pharmacokinetics, I just added a couple extra things to my poster here, such as applications and forms of thrombin. So I have a list of different types of products that you may even come in contact with during your rotations at your clinical sites. So we have Thrombogel, we have Thrombopad, we have Evithrom, which is our topical human thrombin. It comes, it's frozen, so it needs to be thawed before use. And then our Recothrom, which again, it comes in a powder and it needs to be reconstituted before use. And after it's reconstituted, it actually needs to be used immediately or at least put in the fridge. So we have Vitagel, Tacil, Evasil, Surgiflow, which is the thrombin that can be mixed with our flowable gelatin. Actually included an illustration of Surgiflow here. And then we have FlowSeal, which essentially is pretty much the same thing as Surgiflow. And I also added an illustration of the physiology of our clot formation. And then I also added a label for our topical thrombin of bovine origin. So if you want to take a look at that on my picture. And then I also added a list of sources. So feel free to take a look at those on the picture that I post if you want to do your own research. And that is my presentation on thrombin.